we will vote against it if it does not. The insurance companies have had decades to provide the kind of coverage that Americans need. They have shown that they cannot or they will not do it. 46 million Americans have no insurance. Another 25 million are underinsured. Costs are skyrocketing. Over the last decade, healthcare costs have risen on average more than 4 times faster than workers' wages. A robust public plan based on the current Medicare provider network and infrastructure and rates will be able to change this. Setting rates based on Medicare will provide much needed competition and force insurers to control costs. Using the Medicare provider network will reduce startup costs by $75 billion and ensure the public plan can begin when the new health exchange is set and ready to go. Many of us favor a single payer system standing up here today. But we have compromised. We have rallied because we want a plan with a meaningful public option. And we can compromise no more.
Absolutely.
When leaders of the House meet in August to consider the 3 bills and produce a final one, we expect that it will retain a robust public option. If it doesn't, we will vote against it. I now would like, we're going to have all of the chairs of the caucuses speak today, and then we will have a few other members who want to say a few words. Then we'll have questions for as long as you choose. Barbara Lee, Chair of the Progressive Black Caucus.
Hear, hear. Thank you very much, and thank you for being here. I am Barbara Lee from the 9th Congressional District of California, Chair of the Congressional Black Caucus, 42 members strong. For many years, members of the Congressional Black Caucus and our allies here, our colleagues here in Congress and around the country have been leading the charge on comprehensive and for comprehensive health care reform. Today, we are closer to providing quality health care to all Americans than ever before, but the fight is not over. We must continue to reject these claims that the cost of reforming health care in America is something that our nation cannot afford. We reject that. The money is there to pay for coverage for all Americans. To the contrary, if we act, and if we fail to act now, we do so at the peril of the American people. The American taxpayer will continue to suffer from the economic consequences of absorbing health care costs that are spiraling out of control. We must act because the quality of life of millions of Americans and the health of our economy hang in the balance. But to understand all of this, the cornerstone of comprehensive health care reform is a robust public health plan option similar to Medicare. Medicare has worked. And so let me be clear, there are many of us who will continue to fight any efforts to water down a robust public health plan option like Medicare. We're going to fight this with every bit of our strength that we have now and until we come together with this 3-pronged bill in September. The benefits, we're going to fight this. The benefits of a public health plan are obvious. A public health plan will guarantee coverage regardless of pre-existing conditions. A public health plan will give patients a choice of doctors and hospitals. And a public health plan will build in incentives, mind you, for private insurers to lower health care costs. That's what we want, lower health care costs. And that's why a public health plan is extremely important. When it comes to the public plan, we know that the Congressional Black Caucus, the Congressional Hispanic Caucus, the Congressional Asian Pacific American Caucus, and the Congressional Progressive Caucus speak with one voice. Speak with one voice. Healthcare should not be a privilege as it has been in the past. It is a basic human right and should be a basic human right, actually. That's what we're saying. It should be. It should be in the wealthiest and most powerful country in the world.
Yes.
I give you now my colleague who chairs the Congressional Hispanic Caucus, Congresswoman NYDIA VELAZQUEZ from New York.
Thank you. Thank you so very much. And I want to thank all my colleagues for standing up for working families in America. The message is clear. The American public expects for us to pass comprehensive health care reform, one that really provides access to quality health care to every American, especially those working families and the most vulnerable. It is amazing. In the richest, most powerful country in the world, 47 million Americans every day goes by without access to health insurance. We are here to say we cannot support any deal that shortchange working families and the most vulnerable in our country. So I stand here and say that, you know, business as usual is not going to work. We will not be able to support nothing less but real comprehensive health care that has a strong, robust public option. We are saying that we need to lower healthcare costs. The only way to lower healthcare costs is by providing competition. And the only way that we can provide competition is by having a public option. Also, we must ask, in all of this, where is the accountability for the insurance companies? How do we ensure that they are held to higher standards? So I know that we're going to go home, and I will ask the public to visit members of Congress and to share with us a strong commitment and a strong desire to do what is right for all Americans. We cannot achieve anything less, nothing less, that will not cover the working poor and the most vulnerable. Thank you.
Thank you. Okay. Mike Honda, where are you? From the Asian America? Come up here.
Thank you, Congresswoman. I'm always behind you.
I'm behind you now.
Well, first of all, I want to thank the media for being here, because it's through you that we'll be able to get our stories out. And we stand here to support the progressive colleagues in the Energy and Commerce Committee and in the House of Representatives to firmly state my unequivocal support for a robust public option in opposition to the so-called compromise being pushed by 4 members of the House. The recently reached compromise in the Energy and Commerce Committee will, 1, cost more than the original bill, 2, impose a greater burden on working families, and 3, gut the public plan, eliminating access to subsidies for families between 300 and 400% of poverty. The people of my district are relying on us to bring true reform to the healthcare system, and this is not it. Every day I receive calls, emails, and visits urging me to preserve a strong public option that will help to drive down the cost of care and allow more families the protection of health coverage. The private insurance companies have had decades to provide meaningful reform to our system. They have failed, and Congress must now act boldly in order to save lives. 11% of my constituents in my district, better known as Silicon Valley, lack health coverage completely, and more are underinsured. And without a robust public option and a meaningful subsidy structure, my constituents and constituents across this country will continue to struggle with the high cost of private care. In my district, families below 400% of poverty are barely at the median income level and struggle to buy homes, make rent, pay for foods and gas. A strong public option is necessary to truly reform our healthcare system, and I will not vote for a reform without one. And let me just close with this thing, that a lot of us have come to Congress and a lot of us are in office right now because people want to change. We said during the last campaign, we can do it. Now we have to fulfill that word. Thank you.
I need to